Okay, good afternoon, good morning, and good evening, everyone. My name is Yolanda Moyo. I'm from IAVI. I'm the Senior Director for Policy Advocacy. And on behalf of IAVI, Africa Vaccine Manufacturing Initiative, Africa CDC, I would like to welcome you all to this webinar on vaccine security in Africa. And firstly, before we start, I'd like to acknowledge our donors, our various donors that support our work, and in particular, USAID, who are supporting this webinar today. So before I introduce or give the reins to Rachel, I'd like to give a few brief introductory remarks. Vaccine manufacturing is complex. We all understand this. It requires large investments, not just financial investments, but also infrastructure and human resources. And capacity for vaccine manufacturing in Africa is not a new topic. It has been discussed over the years, and there seems to be more reasons why the discussions and calls to action could not be advanced than those that support actions to drive the agenda forward. The COVID-19 pandemic has shown us that inaction is not an option. There is no better time than now to start investing in African vaccine manufacturing. However, this process will not be without challenges. We need to prioritize financial investments, market access, public-private partnerships, enabling policies, strong leadership and political will, regulatory systems that are robust to regulate across technologies, and we also need to focus on technology transfer. The good news, however, is that there is renewed impetus for local vaccine manufacturing and development in Africa as we prepare for future pandemics. The objectives of this webinar today is to unpack the vaccine development and manufacturing landscape in Africa and to advocate for pathways towards local manufacturing of vaccines, casting a spotlight on various initiatives, collaborations toward end-to-end vaccine R&D, and establishing a viable, sustainable vaccine development and manufacturing ecosystem on the continent. Without further ado, I'd like to hand over to our moderator for today, Rachel Muthoka. Rachel is going to be moderating the session. She will also introduce our distinguished speakers who are here today. Thank you so much, Rachel, and over to you.
Thank you so much, Yolanda, and thank you so much for those really enthusiastic remarks. What we're looking forward to today is about 2 hours of engagement, of joint strategy, joint thinking, and we hope that we can be able to come out of this session with some very useful inputs that we can be able to share with the rest of the world as we discuss this most important topic of vaccines and which way next. So as she said, my name is Rachel Muthoka. I am the CEO and founder of On Point Policy Advisors. I work in the policy advisory space, and I'm really proud to be working with IAVI and happy to be working to roll out this meeting. Maybe just a few remarks before I let in our speaker is to say that even as we go on, it would be useful to know who is in the room with us. So if you could kindly go into the chat box, tell us your name and the organization you represent. It would be interesting for us to get to meet each other in the chat box. And beyond that also, even as she speaks, if you have any comments or feedback, I would be happy for you to share it in the chat section. So it is my great honor this afternoon to introduce Dr. Lindiwe Makubalo, and she is the Assistant Regional Director at WHO Afro. She is an experienced public health expert. She has served in the South African Public Service for over 2 decades, and she has led initiatives that have advanced equitable health access for all. She has a lot of experience in disease surveillance, data management systems, research and innovation management, with a clear focus on tropical diseases and HIV. She has worked at WHO headquarters, where she was the Director of Alliance for Health Policy and Systems Research, and she has also taken a sabbatical position in the Special Program for Research and Development in Tropical Diseases. So she serves on so many bodies that I'm not able to list them today, but really it's a great honor for us to have her and to really hear her views, even as we commence this meeting. Dr. Lindiwe, over to you. Thank you so much.
Thank you so much, Madam Moderator. It is a real pleasure for me to join this meeting today. I'd like to thank you, thank IAVI, the African Union, Africa CDC, and all the organizers of this meeting today. It's really a very important meeting, as you have said, and yeah, it's a real pleasure for me to join. Thank you for your very kind remarks. Let me start by extending my appreciation again for us for such a timely meeting. COVID-19 has laid bare the underlying and systemic inequalities, especially with regard to accessing COVID-19 vaccine across the African continent. I think this is a topic and figures that are shared very often and is of great concern to all of us on the continent. There could not be a better moment than now for us to confront the difficult questions, tough questions really, around how Africa should chart its way forward for a sustainable future in terms of our continent. It's often an elephant in the room because it touches on some very sensitive issues. It's not time for us to really speak about political will as such. Political will is required, but rather now I think we should be talking about political action and support aimed at accelerating sustainable access to vaccines on the continent. Fortunately, the COVID-19 pandemic has really accelerated interest, support, and we have seen so much government support and support of all partners in terms of responding to COVID-19.
Dr. Makwalu, we are struggling to hear you. We seem to have some background noise from your end.
Okay, my apologies. Maybe try to adjust a little bit. Come a bit closer. Establishing vaccine manufacturing in Africa has emerged as the only sustainable solution that can guarantee security of vaccine supply in the fight against vaccine preventable diseases, and also in the vaccine, and also in the fight against pandemic diseases. It is well proven that vaccines are amongst the most effective health interventions of all time. Despite this, WHO estimates that 1.7 million annual deaths amongst children under the age of 5 are due to vaccine preventable diseases. The 2019 data shows that before the COVID-19 pandemic, nearly 1.4 million children missed out on self-saving vaccines such as measles and DTP3. 70% of these children live in Africa. Although there are many factors that prevent children from being immunized, including political instability in a country, the strength of the immunization programs, such as the number of health workers, facilities, cold chain, etc., are lacking in many settings.
Sorry, doctor, but sorry to interrupt you. It seems we're still having a problem with the sound. Yolanda, are you able to check what's happening? The sound is coming out very garbled. I think we're still struggling to hear you.
Okay, maybe if I can just see if I can't use another device for a minute, please just hold on.
Okay, yes.
Okay, I'm back. I hope it will be a little bit better. My apologies, we're in the middle of the regional committees, so there's a lot of activity in the background. So maybe this is it. I'll just try to see if we can improve the sound now. So I was saying that since the COVID-19 pandemic, at least 13 years olds and rubella campaigns were cancelled or disrupted owing to unavailability of vaccines, leaving millions of children unprotected. Almost half of these children live in the African region. It is also well documented that there are huge inequalities in access to new vaccines between children in developed countries and developing countries. The situation is further exacerbated by the lack of vaccines against poverty-related diseases that predominantly affect Africa due to the lack of research and development. In the light of this, WHO is more than convinced that improving access to vaccines in Africa through encouraging local development of vaccines has to be prioritized. In my role as the Assistant Regional Director, I've set out to work closely with the value chain actors, including vaccine manufacturers, in championing the agenda for establishment of viable manufacturing capabilities for vaccines and other biological products on the continent. I have since started on a journey to strengthen our capacity to be able to deliver our support in this area. Specifically, we want to be your valuable partner in shaping a sustainable market for locally produced vaccines by working closely with governments, policymakers, regulators, and other partners to establish policies, strategies, frameworks that support sustainable demand for locally manufactured vaccines. We engage global partners like IAVI, UNICEF, and others to influence policies regarding procurement mechanisms. This is very important for us. We will also intensify our efforts to sustainable financing, including through domestic financing mechanisms. At the ongoing regional committee, countries are really warming up to the fact that they have increased financial contributions through domestic finances, so that they will be, they are committing to increased financial contribution through domestic financing. That will go a long way in addressing some of the complex health challenges affecting our continent. At regional level, there are also discussions about how financing can be prioritized in such a way that WHO and countries can be supported in a much more sustainable way than they are right now, because I think the sort of financing systems are not so sustainable at the moment and really dependent. Through our network of international partners and manufacturers, we shall continue to facilitate technology transfer and capacity building opportunities for African manufacturers to leapfrog some of the manufacturing processes and leverage opportunities that new technologies have to offer. Our future should not be someone's past. Our underlying principle is to promote access to safe, quality, and efficacious health products to the people of Africa and the African continent. I do realize this is a complex challenge and that requires a concerted effort amongst various stakeholders. I subscribe to the notion that the whole is greater than the sum of its parts. It's through a platform like this that we can spark new thinking, ignite new partnerships, and embrace opportunities for better health delivery in Africa. With this few remarks, I would like to thank you. I know it's a very broad topic that you cannot exhaust, but look very much to hearing from other panelists. And my apologies for the sound challenges. Thank you very much.
Okay, thank you so much, Doctor. And we've had some sound challenges, but we were able to get some of the feedback and the input, input from your speech. And we really appreciate the offer of partnership that you have given us in terms of looking at the intention that you have to work with value chain actors. I think many of us in the audience would find ourselves in one space or the other in the value chain. And so we really appreciate this of our partnership. I think beyond that is also that looking at, and I think for private sector in the room, your reference to a sustainable market, shaping a sustainable market so that, because we all know and understand the cost of research and development, and the cost that companies and institutions have to go into in order to be able to develop for us the vaccines. And so being able to look at the sustainability of the market and your partnership in ensuring that, I think, is greatly appreciated. And lastly, also just understanding some of the more very pragmatic proposals, talking about financing systems, talking about technology transfer. And even as we go on with this meeting, I'm really keen to hear some of the unpacking that will come about and that we'll be hearing from our speakers about what are the key things that we can do to ensure that the technology transfer is happening and that we are being able to get African manufacturers leapfrogging and being able to take advantage of the opportunities that all the research and development that has taken place before presents to us. So thank you so much. We really appreciate you taking your time in the middle of the busy session and being able to join us. And we thank you, and we cannot say thank you enough. And we hope you can be able to hear some of our ongoing conversation, even as we speak going forward. So thank you very much. So it's my great honor. Yes, it's my great, so as I also mentioned in the chat section, I mentioned that for those who might have had a challenge hearing the presentation, hearing some of the content from the speech, we'll be requesting Dr. Makubalo to share it with us, and we'll hope that we can be able to share it on email to all the participants so that they can be able to get the full content and to have more time to interact with the speech. So we look forward to being able to do that. So at this time, it's my great honor to commence the panel conversation. And this panel, and we have a really rich panel of experts who are looking at different components within the value chain of vaccine manufacturing. And we are hoping that we can be able to hear short, quick, but very interesting and very impactful presentations that would help us to understand different parts of the vaccine value chain, and also what different partners and bodies are doing in order to accelerate the work that's being done. So the first in line is Dr. Nikes Ndembi from Africa CDC. He'll be speaking to us about accelerating vaccine production in Africa through strengthened human and institutional R&D capacity. So unpacking what Africa CDC and CEPI have done in the collaboration that has been taking place. And we really look forward to being able to understand how that collaboration is going, but also beyond that to understand the work that is happening on the ground. So Dr. Ndembi serves as the Chief Science Advisor to the Africa Centers for Disease Control and Prevention. He's an adjunct associate professor, Division of Epidemiology and Prevention of the HIV at the University of Maryland School of Medicine in Baltimore in the US. He's a member of Pharma Access Technical Advisory Board for the Pan-African Study for Evaluation of Resistance in Africa and the WHO Resistance Network. He's also the chair of the Africa Task Force for Novel Coronavirus on Science and Regulations, and leads the Partnerships for Africa Vaccine Manufacturing PAVM in Africa. He holds qualifications from the Kanazawa University School of Medicine in the Department of Viral Infection and International Public Health, and has been the principal investigator on numerous grants that have looked at various sections, and he has co-authored or authored more than 140 publications. Wow. Dr. Ndembi, I think we cannot be in better hands, even as we unpack the partnership and get to understand how these partnerships can be used, even as we proceed with in the pursuit of ensuring that Africa has vaccine security. So Dr. Ndembi, over to you.
Thanks, Madam Chair. I'm going to share, if you allow so to share my slide. If you can see it over there, please let me know.
Yes, we can see it now.
Yeah, thanks so much. I really would like to thank the organizers and especially Patrick Tipo to reach out to Africa CDC to really bring our voice to this initiative. I think Patrick has been on this field for years. I think it is an opportunity, at least with the COVID pandemic, to strengthen our capacity for vaccine manufacturers, vaccine manufacturing in Africa. I think that's quite great. There have been initiatives, I think you recall, I'm sure IAVI is aware of this, and those on the call, even from WHO, and those that have good memory, of the African AIDS vaccine program. It ended up, it was a great initiative, both African and non-African to drive, but there was really a clear momentum. And we didn't set the target, and we didn't have a continental aspiration. And that's why drives is like you have the engine, but there's no fuel. I mean, it occurs, there's nothing you can do. I think now we have a situation at hand, and we really want to move this initiative forward and come out of COVID, this COVID pandemic, stronger than before. I think that's where those that have been on this field, they will understand what I'm referring to. So what is our vision? To be able to move this, we really have a clear vision, because that's what it's going to provide kind of aspirations and direction to what we're doing. Yes, we agree we're going to definitely strengthen our capacity. We're going to be sure that based on the data that we have currently, we need to really improve our production line, if not even produce at least those that can be as part of our global health security, at least on the continent. I think it's quite important. So these are our visions to ensure Africa has timely access to the vaccines to protect public health security by establishing a sustainable vaccine development and manufacturing ecosystem in Africa. I think we have said it all. We need a kind of a very strong ecosystem for vaccine manufacturing. So where are we? This slide, I think it's clear, 99% as we speak of the vaccine are imported, 1% produced locally. And we want to see that at least a change from at least by 2040, 40% imported, at least 60% produced locally. This is the target. And the target, it means we can actually achieve this target in 10 years. That's fine. But we need to put all those, I think, requirements to be able to get there by 2040. I think we aim for that. Those, again, as I've said, that have been on this field for long, we set targets and we meant to actually achieve them. Let those who have said 95, 95, 95 is actually a target that is quite ambitious, but actually we all strive to get there, at least get those 95% that have been tested being placed on treatment. Yeah, we're saying we really want to see the continent of 1.3 billion people by 2040 being able to produce their own vaccine, at least 60%. I think that is important. Let's stop being consumers and let's start driving initiatives that have been there on the continent for quite some time by actually providing framework and actually also instrument for them to be able to get there. So I think it's clear. We do not want to have vaccine manufacturing capacity just COVID related. So it's very important that we start thinking beyond COVID. So looking at vaccine of non-global pathogens, non-African pathogens, routine immunization. We've seen already outbreaks as we speak of Marburg, of Ebola. Now we have to deal with COVID-19 and we have to import some of these vaccines. So it's a lesson that we need to have to think out of the box. I think that's quite important. Strengthen Africans' pandemic preparedness and agility. Develop and manufacture products that meet African needs. That's quite significant. And also being able to look at it even broader in a broader perspective, being a kind of powerhouse of even some of the vaccine manufacturing. India has been doing that. We have imported some of this vaccine from India. Why? We could also do that and export some of this vaccine outside of the continent to other countries or continents that are in need. We have that capacity. We should be able to do that. And then also vaccine through our routine immunization program, a childhood immunization program. That's why actually we put much of our funding in. So I think we need a business really model, yeah? And it has to be sustainable. And then to be sustainable, it has to be profitable. Someone has to really be able to establish a system. Patrick, Bavac, and others have shown that they have the system in place. We need to sustain it, to be able to actually encourage donors to put in money and invest into vaccine manufacturing. So I think we have a buying from the leadership of the continent. What do we need? I think the highest leadership, the head of state, have said, yes, We're behind supporting or providing technical instrument, political leverage for the continent to be able to produce its own vaccine for the global health security. So that's led to the establishment of what we call the Partnership for African Vaccine Manufacturing. For those again on this call, you recall that in April, we had a summit where all this discussion around where do we move from here. We've seen the initiative again from the Africa Vaccine Manufacturing Initiative with Patrick and team that have pushed forward, pushed, and then really now it's time to support, get other leverage, political leverage, and also support financially for them to be able to drive some of this continental. It means that we have talked through that process. And now it's time now to have a clear vision and aspiration of where we plan to be. And that's what actually we all aim to achieve towards this kind of meeting and workshop. So we recall during the summit in April, President Kagame saying vaccine equity cannot be guaranteed by goodwill alone. As we have seen many examples to convince all of us, Africa needs to expand production capacity for vaccines and other essential medical products. That's true. And it speaks volume specifically in this context of the COVID-19 pandemic. So as a response, we set up what we call a task force. Some of you on this call are actually part of this, some of the work stream as part of the PAVN initiative with a coordinating role, that convening role of the African Union, Africa CDC, bringing the best of the mind, la creme de la creme as we speak, to really brainstorm on where we think we need to do for this continent. So there are several actually work streams. Then the market design and demand intelligence, important. It's good to manufacture, but where do we get this product at? You can manufacture 200 million vaccines on the continent, but do we have the market to be able to absorb that? That's where the political leverage muscles will come in and start actually being sure that we actually find a market where we can get it. That's where, again, the call to move in a very coordinated way, not fragmented way, because if each of the 55 member states would like to establish vaccine manufacturing plan, that's going to not be really a good way of moving forward, which we're definitely not encouraging. We're actually aiming to work together to be able to achieve this aspiration. I think that's important also that Madam Chair, you mentioned it, the value chain. I think based on the strength, some can actually decide just to get to the vials for the vaccines. That's another point. I mean, of you're contributing at your own level as a member state to be able to do that. I think that's important that we start thinking how we can strengthen existing capacity, and that's the vision we're having, working closely with WHO, CEPI, and order to build research TTT, what we call tech transfer training hubs on the continent to be able to at least provide that kind of direction and guidance and support to member states. The regulatory strengthening, we know very few have achieved the ML3 using the WHO benchmark global tools. The access to finance, we definitely can do that if there's a political will, technology and intellectual property. I'm sure Martin will touch base on that. The research hubs, that's what actually been asked, and talent development to touch a little bit base on in the next few minutes that I have, and infrastructure development. So I'm not going to go through, I'm going to share this slide, but the R&D hubs and talent development, the conceptual framework, we do have a package with working closely with the expression of interest of WHO on what to go into a tech transfer training hub. But here we are looking at how do we contextualize our curriculum so that in the long run, recall this is an aspiration up to 2040. We need to start building infrastructure, building human resources, workforce development around research and development for vaccines. That's important. How many universities, how many countries actually have that curriculum around innovation and vaccine development, vaccinology? There are very few. And then if you want to meet that aspiration, you have to get building blocks to be able to put all those together and actually create that vision in terms of know-how. Know-how will be what we call practical knowledge and skill and expertise. You need that expertise that can be built from the university. I think it's important that that's actually been very clear. So that several networks, and then that come into play that we can leverage on the continent. You can see from this map that North and South collaboration of over 42 organizations that are working hand in hand to be sure that we move public health not only, and also innovation in research and technology in our curriculum on the continent. And that's very important. So it means that we'll need to give really thoughtful consideration to the mixed product and the manufactured product over time. What are we looking at? What kind of curriculum can be adapted or customized to be able to achieve that? So what we think the best way, as I've said earlier, 55 member states, 1.3 billion inhabitants, we can afford to go in a fragmented way. So at least if 5 research hubs or 5 research manufacturing hubs, that could include the TTT that I did mention earlier, in the 5 regions, that will go a long way in terms of aggregations and harmony and in terms of synergy in driving this initiative. So we had that political leverage, as I've said, to convince member states to agree on certain things that are good for the movement and then get things moving on the continent. So at least 5 in West, Central, Southern, Eastern, and Northern Africa. They all have, if you look at the SWOT analysis, they only have strengths and weaknesses. I think in even the population density, the market, at least landscape as well. So alone, we can do so little. Together, we can do so much. That's why we're here. I think we need to work together. We need to establish those partnerships. One of the key examples that I'm going to just bring up to close my presentation is around the genomics. We're going to develop, actually get these antigens. At least we all agree, clinical trials. We have to start undertaking some of these clinical trials on the continent. And you want to develop your own antigens, you need to know your virus, the granular data. It's very important as we build research and development. It's evidence-driven. So in collaboration with WHO, Africa CDC, and other partners, we've established a network within the continent. That's where we're being able to say some of these vaccines or some of these variants of concerns have impact on vaccine efficacy because we have data, because we generate our own data, because we look at it systematically. I think it's important that we start building on that on the continent. So in the next, you can see that we've developed at least a training package for next generation sequencing. We plan to generate about 100,000 sequences that will be deposited in GIZ. That will help. I will put all the sequences, align them to generate actually and start looking at antigens that could actually be potent, at least for our own continent. So these are modules that we see, I think, introduction of genomics epidemiology. That's one example among others that is a part of that capacity building. And then you have networks of research universities across the continent. You can bring all together, brainstorm, how we can see to transfer that what we really want to for the next generation in terms of know-how. So I think that's is one of those examples, you know, the Arua ones, and then all their network and spread and footprints on the continent. Quite important, I think we're clear, the vaccine concept, preclinical, good manufacturing practice, the phase 1, phase 2 clinical trial, all those are interlinked if you put it into and fit into research and development and human capacity. So to land here, with CEPI, we signed actually an MOU. The aim actually of the 3 pillars there: innovation in vaccine manufacturing, talent and technical know-how, and enabling sciences. Very important. There are some cross-cutting enabler, and then we need to really leverage on those ones. And then the existing network of partners that we have, including those on this call. I think where are we on that MOU with CEPI? We're working closely, really in partnership here. There's a joint steering committee that is being set up to be able to manage the MOU activities. Then CEPI has appointed a focal person starting in September to work closely with Africa CDC. That will be at Africa CDC headquarters. And what we look into the nearest future is really to be able to have a survey on really capacity on the continent in terms of all those key different elements falling into the work streams. And then CEPI experts are contributing to different of the work streams that we have. I think that's a good way, a set way to start the partnership. I think we're meeting a couple of days to be able to
allow me
that.
to interrupt
So,
you.
thank you so much, and back to you.
Oh, great. I was just getting to say, I'd like you to start to wind up. So thank you so much for that wonderful overview, and we can see the very strong partnership that also shows the work and the support that you're doing through the MOU. And just one question that has come up on the Q&A, and Dr. Ndembi, if you can take this before you stand down, is really looking, there are two people have raised the issue, but the issues are the same, which is funding. So in terms of looking at venture capital for the green and brown fields and also private equity for established companies, recognizing that this is an expensive process, would you like to make a comment about funding for the manufacturing itself?
Yeah, I think that's good. What I usually respond to that kind of question is that we shouldn't look at that as a barrier, okay? And that's why I'm saying that, because we haven't convinced enough the financier and those that are putting money to the table. This is a business, and all business, they have a risk. And to be able to convince them, we need to really have that commitment. I think we have said that before, even for vaccine acquisition. This continent, we have been able to mobilize $2 billion for vaccine acquisition. That's the same. We'll make a case for vaccines, that's the money going to come up. So that shouldn't be a limiting factor. And then we have different initiatives. We have Team Europe that have put in 1.3 billion euros to support vaccine manufacturing. They're going to be on the call tomorrow with us to actually put in a signal to member states, come with a vaccine manufacturing plan. Okay, then we have the MasterCard Foundation. They are putting $1.3 billion for vaccine manufacturing, a company of vaccine manufacturing. There's money. Come with a business case. Come with a vaccine manufacturing plan. We need to stop that narrative that money is the problem. Thank you. I'm back.
Thank you so much, Dr. Ndembi, and you're preaching to the converted. I am a true believer that there is funding. What needs to be put in place is a solid plan and a solid strategy that can then be funded. Thank you so much. We appreciate. I can see lots of comments. Appreciate in the comment section, appreciating your presentation and the show of partnership. We thank you so much for taking the time to come and speak with us this afternoon. I would like to take us to our next speaker, Mr. Martin Fried, who leads the vaccine research unit at the WHO in Geneva. Martin, if you could kindly start to share your screen. Thank you.
Okay, quick check. Can you see my screen?
Yes, we can. Thank you so much.
Okay. Right, so thank you very much, IAVI and AVMI. First of all, this has been a long journey. I'm delighted to see in the participants quite a few people that have been working with WHO and with me over the last 20 years in doing technology transfer for vaccines. It's also great to follow on from Nikesh. Nikesh has touched on a lot of the topics that I'll be able to gloss over more briefly, but let's get into this. I'm going to talk about multilateral technology transfer as a tool to accelerate vaccine manufacturing and supply in low and middle income countries, particularly looking at the case for Africa. So just a quick high-level summary of the different ways of expanding vaccine manufacturing and vaccine access. So we often talk about fill finish, where you've got a manufacturer one. This manufacturer's got an excess of bulk vaccine. So this manufacturer can send this bulk vaccine to other manufacturers. So essentially, their filling line at manufacturer one is the bottleneck to the supply. And now we can get filling being done. And we're seeing this, for example, the Johnson & Johnson vaccine being filled at Aspen in South Africa. Pfizer has announced that the mRNA vaccine is going to be this fill finish at BioVac in South Africa. So this is good. It does provide some increase in supply. We'll get to the challenges in a moment. Now, what is really preferable in the long term is that the country is actually able to manufacture. And this requires technology transfer for the entire process. And in the past, what has typically been done is what we call bilateral technology transfer. You've got a manufacturer one that has established the process, and they will then transfer the entire process, and very importantly, all of the data, including clinical data, to manufacturer two, who will then establish the full production process for the vaccine, and you'll now have two manufacturers producing the vaccine. If manufacturer two is big, this will result in significantly increased supply of the vaccine. And we'll come to the pros and cons of this in a moment. One of the biggest challenges has been to try and get manufacturer one to share his know-how. And this is particularly with COVID, this has been one of the big barriers. So the third model, which is the model that WHO has really been pushing, is the multilateral tech transfer hub. And this was really developed after the 2006 pandemic influenza scare, when the pandemic influenza vaccine manufacturers were not interested in sharing their know-how. So what we did there was we established what we call a technology transfer hub. And for us, a hub is a training center. And to this hub, we brought the inventors, the developers, the researchers, the experts, and the IP holders. We established the process at the hub. This first hub was done in the Netherlands. And the entire process to manufacture the pandemic influenza vaccine was established at the hub. And then we invited manufacturers from around the world to come to this hub, learn the process. And they received the entire process for industrial scale manufacturing. They went back to their countries, established it, and began producing influenza vaccines. Now, just a quick thought about the pros and cons here. So fill finish, of course, can be quick. This can be done in less than 12 months. We've seen this in COVID. It does not demand a highly skilled workforce, it demands a skilled workforce, but the training can be relatively easy. However, it is limited by the supply of bulk from the originator. If the originator doesn't supply bulk, then you can't do much. And the country or region does not become autonomous. I do want to highlight that we now are seeing cases, which I'm going to refer to as neo-colonialism, where a northern manufacturer is doing fill finish in the south, but all of the vaccines coming out of the south then go back to the north, and the south doesn't actually receive any and has to get in line to procure the vaccine like others. Now, the bilateral tech transfers, these can be quick because they don't need to redo clinical development. It's slower than fill finish, but it's quicker than the tech transfer hubs. This, however, requires a win-win ecology. Win-win from both sides. Why is the donor going to do this, and why is the recipient going to do this? And in many cases, we've not been able to get the win-win situation. Typically, only one or two countries benefit. That's a problem because WHO wants the entire world to benefit. It requires infrastructure and a trained workforce. Often the workforce is inadequate, insufficient, and this is one of the reasons that we can't get these bilateral tech transfers. And depending on the contract, this can provide national or regional autonomy. However, in many of the contract said you will only produce this vaccine, you will only produce this much against this target. So it doesn't give real autonomy. And what WHO is trying to get is to empower countries. And bear in mind also the supply of reagents can prevent autonomy. So for example, with mRNA vaccines, if you're not also able to produce the reagents you need, and you need to get these from the north, then this is going to be a limitation in autonomy. So the tech transfer hubs, in comparison to this, they are slower because it requires full product development and clinical trials. However, it serves many, even all countries, provides autonomy, it empowers the countries. There's workforce training provided at the hub. This can work with existing infrastructure or new infrastructure. The challenge, which has been mentioned by Nikias, is how to make this sustainable. And in Africa, where we really need to be thinking, it is how many facilities can we actually afford to have in Africa that can be sustainable, and what is the business model to sustainability? Just a few thoughts on key things to take into when we establish the tech transfer hubs is what is the technology? We need to generate consensus on what technology to make sure that it is affordable and useful. We look at the intellectual property. Fortunately, in much of Africa and many of the low and middle income countries, intellectual property has not been filed. The fact that a patent has been filed in the USA and Europe, but not in Africa, it means you can operate in Africa. We need access to the know-how. So, for example, with the mRNA vaccines, there's no IP in Africa, but there's also no know-how. So we're working on this right now. What is the capital expenditure? What is to build the facility? What is the cost per dose, the OPEX? And is the vaccine we're going to produce, is it going to be at least comparable in price, a little bit more expensive, a little bit less expensive, but we cannot afford to be having a tech transfer resulting in much higher cost of goods. We then typically set a call for setting up the hubs. We generate the funding. We look for the incentives for both the hub and the recipients, and we then establish the operational agreements. I'm going very fast. These slides will be available to you. Just a quick overview of what we've done in the past. From 2006 to 2016, we've set up hubs for influenza vaccine training, for live attenuated influenza vaccines, for adjuvants. We've set up hubs. We've also set up hubs for rabies monoclonal antibody technology transfer. And you can see those round dots all over the world of where we have transferred the technology to. Those of you that know some geography will realize that when you do cut and paste in PowerPoint, South Africa suddenly finds itself in the north of Botswana. My apologies for that. And also just a quick highlight of what this resulted in from 2006 to 2020. You can see this has taken time. From 2006 to 2015, our tech transfer activities only resulted in about 300 million doses of pandemic influenza capacity being established. That's 9 years. It was only in the 10th, 11th, 12th, and 13th years that we actually got this over 1 billion doses. And this is because of the time that it took to get the technology established, but then go through all of the phase 1, the phase 2, and the very lengthy phase 3 trials. Hopefully for COVID, this is going to be much faster. But I do want to point out that this tech transfer typically does take a lot of time. You'll also notice that Africa is missing from this list of countries. We did do tech transfer to Egypt and to South Africa. These were not very successful, but the tech transfer done to South Africa has contributed to South Africa now being able to be appointed as the COVID vaccine tech transfer hub. So this leads me into the COVID vaccine manufacturing task force, what we're doing for COVID vaccines and LMICs. Just quickly highlight that there's really three areas of work here. There's a work stream 1, which is about creating access to the upstream supplies, the glass vials, the reagents, things like that. There's work stream 2, and that's led by CEPI, work stream 2 also by CEPI and with Gavi. This is looking for bilateral fill finish and bilateral tech transfer. And workstream 3, led by WHO with Medicines Patent Pool, is about establishing these technology transfer hubs to expand the capacities at the existing manufacturers in low and middle income countries to ensure that they get the new technology, but very importantly, to establish sustainable capacity in the regions where clearly Africa is the region with no significant capacity. So this is our driving force right now. So you will have, I hope all of you will know that South Africa was announced as being the host of the hub. This was announced on June the 21st, that South Africa, this is a consortium between BioVac and Afrigen, is announced as the hub to establish the technology for mRNA COVID vaccines. And first of all, this will be established in South Africa. Then South Africa will also be the first recipient of the technology for BioVac to start producing the vaccine. But as soon as the technology is established, there will then be training of other African vaccine manufacturers, as well as training of other vaccine manufacturers around the world. So I'd just like to point out what this triggered in terms of traction and alignment was. We announced this on June the 21st. Just over a month later, we had our first workshop to present the consortium and sign the letter of intent. 2 days later, Pfizer announced partnership with BioVac to do full finish of COVID vaccines. And then 5 days after that, BioNTech announced that they will be doing mRNA, malaria, and TB vaccine development, which will be co-located with the South African hub. So how these subsequent activities align with the hub remains, we still need to work this out. Clearly, this announcement played a role in triggering the decision by Pfizer and by BioNTech to work in South Africa and to make announcements of what they're going to do in Africa. So it is already having a clear role in this, but we also need to make sure that South Africa and the other African countries obtain full autonomy to make whatever vaccines they want, when they want, against what they want. And we're going to South Africa in early September to really kick this off and kick off the training programs there. Just to show some homology and alignment with what Nikesh just talked about, the work that we're doing here really contains 6 areas of work. There's the selection of the technology and review of intellectual property. There's looking at the manufacturing in the plants. Are the plants well designed? How do we design a better plant to make sure that when we do the tech transfer, the facility is appropriate? There's the regulatory and clinical development aspect. Very importantly, I'm going to say most importantly, is the business model and financing. It's very easy to build unsustainable facilities. I must apologize, I've done some of these in the past. We want to avoid this in the future because this is a waste of money. So we need the business models to make sure that when we transfer the technology, these are sustainable. The funding and the governance, when we transfer the technology, to ensure that the recipients are under a legal obligation to provide vaccines to the population, the national population and the regional population, and that they're not going to be selling it to the richest countries first. And then also very importantly is the workforce. Very difficult to teach how to make mRNA vaccines if you've never worked in a GMP facility before. So getting the workforce that's ready to learn is critical. Few key words: we want homogeneous and equitable distribution. We want a consistent, tailored network, free access to the technology for everyone. So this is very important, and it must be sustainable in the long term. Otherwise, this won't work. So my last slide is really just to say that we've been relatively successful in the past for influenza, for adjuvants, for rabies monoclonal antibodies, of which 2 are now on the market. We're now at the beginning of a multi-year journey to establish low and middle income country manufacturing network, first for COVID vaccines, mRNA, and then other technologies. And I really look forward to working with all of you, as well as the other panelists today, to make sure that for this time we get it right. We've been talking about manufacturing in Africa for the last 15 years. Patrick Tipo, who's talking now, and I have been working together on this for many years. Each time we talk about it, the political will was not there. Now let's try and make sure the political will is there. I'll stop there. Back to you. Thank you.
Thank you so much, Martin, and thank you so much for very effectively sharing quite a lot of information in a very short time. I think we've all really enjoyed understanding exactly what's happening and really getting a lot more insight on what the South African hub would look like and what the potential impact for it could be. I see a question for you in the Q&A from Roger. His question is, what is the difference in cost of goods and the impact on final product? Would you like to speak to issue of costs?
Okay, this is very complex. How long is a piece of string? But when you build a very big factory, such as Serum Institute of India or the GSK facility in Belgium, this is so big that you've got economy of scale. Now, if you build a small facility, let's just say to meet only the Southern African, the SADC population, this is going to be a smaller factory. You don't have that economy of scale. And so depending on the technology, you might have significantly greater costs. And we have got one example, I will not cite the country, but it's from Asia, where the cost of goods of their influenza vaccine is now almost double the cost of goods of procuring that vaccine on the international market. So they've acquired national health security, but at the cost of double the price of the vaccine. So governments need to be aware that these small to medium-sized facilities, the cost of goods coming out can be higher, even significantly higher than those coming out of the big manufacturers on the international market. But you get national health security for that. Over.
Okay, thank you so much. And I think that's a really pragmatic consideration, even as we talk about who's going to pay for what. We must make sure that we are getting value for money. Thank you so much, Martin. We really appreciate you. And also thank you very much for just introducing, just tying the thread to what Patrick is going to be presenting to us. So our next presenter is Patrick, who I'll ask Patrick to start getting ready. So Patrick Tipo is with the Africa Vaccine Manufacturing Initiative and has been with BioVac, and I think was with BioVac since its inception. Patrick will be speaking to us, and we'll be looking at creating an enabling environment for continental vaccine production, dealing with the infrastructural, regulatory, and market barriers. So Patrick, we really look forward to hearing from you, and over to you.
Thank you very much. Are you able to hear me?
Yes, we can hear you and we can see you.
Okay, and my screen is being shared, is it?
Yes, it is. It's been shared.
Okay, excellent. So I'm going to be talking about some issues with respect to barriers to vaccine manufacturing in Africa. And before I do so, I'd like to just dip into the AVMI briefly and tell you a little bit about some of the work that we've been doing over the last few years. So it was set up with this express mission of advancing and advocating for the establishment of sustainable human vaccine manufacturing capacity in Africa, and that was more than 10 years ago. And over the last 10 years, we've done work in partnership with entities, including WHO, UNIDO, supported by the Department of Health and Human Services in the US. And these are some of the pieces of work that we've done.
Sorry, Patrick.
Yes.
Please, could you put your slides into presentation mode?
Okay, let me try that. Is that in presentation mode now?
No.
No, not yet.
Okay, sorry.
Coming up now. Yeah, that's it. Thank you.
Okay, excellent. Thank you. It's a problem with using two screens, that's why. Okay. So we've done pieces of work with WHO and UNIDO and other partners. But what I want to zoom in on is this study that we did called the Vaccine Manufacturing and Procurement in Africa study, which did an analysis of what was current and present in Africa across the continent, and this was in 2015, 2016. So it is dated, but out of that, we extracted some key points and conclusions drawn. And it was quite illuminating when I revisited this and connected what we established then with the developments and conversations that are taking place now in terms of the Partnership for African Vaccine Manufacturer and other studies that have been done. So there is a limited space for multiple players on the African continent. We can't have a vaccine manufacturer in every country, but as Nikesh says, the concept of hubs would be an important place to start. There needs to be the right level of political and technical support, and that's been reiterated and repeated often. And it needs to be undergirded by a clear, well-founded and coherent regional policymaking and planning approach, which I believe is coming into formation now, and that it needs to be supported by an ecosystem which enables and incentivizes the investment in vaccine development and manufacturing capability. So this was a piece of work done 5 or 6 years ago. Now, when looking at this, we like to state it in the following way, that one has to begin with the end in mind, that it's no good, as Martin says, establishing a capacity and then not being able to sustain it. So when one is looking at building the capacity, putting all the nuts and bolts in place, one has to take a forward view of how this capacity is going to be sustained. And we understand that this is intrinsically tied to access to market and demand certainty. Now, before I share some remarks about the barriers and points to consider when addressing these barriers, I just want to take a few minutes for those of us who might not be too familiar with some of the deeper details with respect to vaccine manufacture. And one could spend hours of lectures just drilling into this slide, but I'm going to give you a very quick overview. So in the white block, we have 1 to 11, and basically it seeks to describe that vaccine manufacture takes place in a number of different steps. And each of these steps have multiple unit processes, scientific technical unit processes attached to them. So we end up with a myriad of steps, and a huge number of quality control assays that need to support this activity. So it's complex. But this is what is required for commercial vaccine manufacture. So if you look at the top, we have the depiction of a value chain. And in order to get to commercial manufacture, you have to start at the other end and build from research into product development, animal testing, preclinical testing, phase 1, phase 2, phase 3 clinical trials. So it's a very long journey, and it's a very complex, interlinked sequence of capacities that one needs to establish. So thinking about becoming a fully fledged vaccine manufacturer, there are a huge number of considerations to take into account. You have to think about the products that you want to make, and Nikesh touched on that briefly in terms of the different categories of product. Those products then, depending on what you identify, will lead you to the technology platforms that you need to build. Together with that, you need to have a view of the scale at which you have to operate and the capacities that you are targeting. And this is a point that Martin made in terms of economies of scale as well. And obviously, all of this comes together and describes the kind of, or informs what kind of facilities we need in place, and the equipment trains that need to be installed in these facilities, and then the workforce that needs to be developed to support the activities. Just a word about the workforce. The workforce is not simply those people who are directly and immediately engaged with the manufacturing process itself, the growing up of bacteria, the harvesting and purification of the antigen of choice, etc. But it speaks to the whole ecosystem around it, the regulatory people, the quality control people, the engineering staff that need to keep the facilities going, the quality assurance team that needs to ensure that a enabling quality management system surrounds all of this and undergirds the activities in the manufacturing plant. Lastly, we need to think about the markets. And in actual fact, one needs to think about the markets first, because it's the markets that will determine which products one would want to focus on. And then all of this, as you can well imagine, not only takes a lot of money, but it takes a lot of time to set up. So the bottom line here and the take-home message is that, unfortunately, one size does not fit all. So if one has the capacity to make vaccine 1, a yellow fever vaccine, for example, it doesn't mean that tomorrow you can simply cross over and make a COVID vaccine or an influenza vaccine. So these considerations need to be very, very well thought through. This is a hobby horse of mine, that we all know that technology transfer partnerships are enabling in terms of capacity building, both in terms of getting to the point of commercialization sooner and having product to sell, but also in terms of training and upskilling the workforce. And the black arrows along this value chain simply indicate the points at which technology transfer deals can connect with local vaccine manufacturing capacity if it's established and on the ground. But the further point to note here is that if you only focus on vaccine manufacturing capability, as important as that is, at the proper scale, as we have experienced with COVID, having the lack of this capability at scale, you are forever reliant on a partner to provide you with technology. And therefore, building the R&D pipeline and capability across the continent is equally important. Another reason why R&D is important is that R&D capacity and the know-how that develops when you build R&D capacity actually enables technology transfers, because you have the ability now to absorb the technology because your workforce is competent, able, experienced, and can absorb the science and the information. So very important to also focus on R&D. And I think it is useful to note that the Partnership for African Vaccine Manufacture vision includes both of these, development and manufacturing. So coming into land then, and dealing with some of the barriers to local vaccine manufacturing, and this Nikesh dealt with quite comprehensively, but I think it's worth emphasizing this point, that over the years, we have lacked a compelling vision that served to draw all the key stakeholders together and unite us behind this goal of driving the capability building with respect to vaccine manufacturing capacity on the continent. We did not have a long-term vision, which was tied to national health, as well as regional health security. Thankfully now, and I'm very excited and encouraged by the efforts led by the African CDC, that we have a compelling vision that has drawn everybody around the table, and all our shoulders are being applied to the wheel now. This forces a changing of paradigms. There are the gainsayers who say it's too difficult, it's too expensive, it can't be done. Can you think it can be done in Africa? But my response to that, why not? Everywhere else, you had to start at a certain point and build. And there's no reason to doubt that it can happen in Africa. Not only should we demand that this paradigm is changed from the outside looking into Africa, but we should also begin to examine how we think of ourselves within the African context and change the way we think and build for future generations. So realization of this vision now is where the action is, and this is where a concerted effort is invested. Multiple parties have been drawn together with, in the form of the framework of the Partnership for African Vaccine Manufacture. So we're beginning to work together within countries and across countries. Market access and policy is the point around which this whole discussion or debate pivots, to the point that we cannot afford to build white elephants, waste money, waste effort and energy, and waste time. This needs to be undergirded by access to market, because access to market, demand certainty is the thing that ensures sustainability. And this means that we need to think about market shaping or reshaping, or how we look at the formation of the markets in Africa and elsewhere in a different way. Currently, we know that one of the challenges is that 40 or more countries depend on UNICEF and Gavi for partial or total subsidization of vaccines. And so there needs to be an engagement with these entities to see how we can create new ways of working to incentivize vaccine production on the continent and guarantee some purchase of locally made vaccines through mechanisms like advanced market commitments and other perhaps more innovative interventions. We need to discuss the possibility of pool procurement mechanisms. We see that happening for COVID within the African context. Can that be expanded generally to routine vaccines as well? So we need to redesign the vaccine procurement process. And I like this idea shared by Prashant Yadav from the Center for Global Development. He speaks of having a resilience premium. In other words, we know that initially these vaccines are going to be more expensive as we get out of the starting blocks and ramp up. But until we reach the economies of scale that other manufacturers enjoy, those paying for the vaccines, whether they be government or other organizations, need to consider what kind of resilience premium would they be prepared to pay and put on the table to ensure and secure that we have national security, and if we don't find ourselves in the situation that we find ourselves in with COVID. So looking at the product side of things and access to product, we need to ensure that we consider the full basket of manufacturing activities, the full value chain, from drug substance through to drug product. There needs to be a diversification, not only of technology spread through locations, but also the products. So there needs to be some level of competition across the continent with different manufacturers, but there needs to be a definite mix of collaboration as well, that we don't all have to do the same thing. And that conversation is going to be vitally important to ensure that we build an industry across the continent that thrives. And as I said before, it needs to include R&D and product pipeline to break the cycle of dependency in a very definite way going forward. So a few last thoughts about access to technology and technology itself. One needs to, I think, from a strategy point of view, and this has worked well at BioVac, where one follows a reverse integration strategy, building capability from packaging and labeling, formulation and filling, and then to drug substance, but also forward integration where you invest in R&D as well. So you're building from both ends of the value chain, connecting in the middle. Technology transfer partnerships are a good way and a good means to secure access to technology. And obviously, workforce development is absolutely pivotal, and we always seem to be on the back foot. So my challenge is, can we raise together with stakeholders funding and create frameworks and plans and platforms for workforce development at risk, so that there is a growing workforce that manufacturers can tap into over time. And these conversations are in progress with many organizations. Partnerships. I think that this thing won't stand a chance of seeing the light of day if we thought we could do it alone. So partnerships are extremely important from a product development perspective, from a technology transfer perspective, from a funding perspective, from organizing the markets, etc., etc. But essentially, it all comes down to one thing. And we can have the best plans on the table, but ultimately these partnerships are going to come to rest and grow on the basis of trust and confidence. And that trust and confidence is linked intrinsically to our ability to deliver against our word and our plans and intentions. It speaks to a commitment, and it speaks to building a track record that will generate the interest and secure the investment, not only of technology transfer partnerships, but from funders for investing in workforce development, infrastructure development, technology transfers, etc., etc. So with that, I will hand back to you, Chair, and thank you very much.
Thank you so much, Patrick, and thank you. So I can see Fungai and others saying that's a great presentation. One of the questions that I can see in the Q&A is on the AVMI report that you mentioned. The question I can see is, how can one access it? Is it possible for you to share a link, Patrick?
Yes, it's available on our website. So if you go to our website, you will find it there. Just Google AVMI Africa and you'll find our website.
Thank you so much. And I do have a few more. I can see Laura has put it up. So I think for all the participants, including Lovemore, if you could kindly go to the link. Laura has very kindly put it up for us in the chat section, so you can be able to download it. So thank you so much. And I have a couple more questions in the chat and in the Q&A, and I'll come to those when we get to the final Q&A session. Allow me to bring Dr. Brenda Oketch on board. So Patrick, if you could kindly disengage. Thank you so much for your presentation. And at this point, I would like to invite Dr. Brenda Oketch, who is from UVRI. UVRI is the Uganda Virus Research Institute. The Uganda Virus Research Institute, and she'll be speaking to us about the work that is happening in that space, and also on how we can adopt an end-to-end product development approach on the HIV vaccine development, the vision, capabilities, and opportunities. So Dr. Oketch, over to you.
Thank you so much, Rachel, and what a pleasure it is for me to be one of the panelists on this very important topic of vaccine security. And I'll just dive in straight away. Indeed, as Africa, COVID has taken, well, not just us, but COVID, I think, is what has really highlighted the challenges, but also the opportunities in this area. And I want to start by thanking IAVI and also AVMI for this really rare opportunity for me, but also for the continuous funding of our work at UVRI IAVI over the years. So I thought I would start with this slide, which really emphasizes the point that the previous panelists have already brought to light, the fact that as Africa, we really have a gap as far as manufacturing is concerned. And I think COVID has highlighted this more than ever, but it's not totally new. So we have contributed over the years in terms of gathering evidence about diseases, but still we could do more as African countries. We've also contributed when it comes to the design of the different phases of the trials, and also actually the carrying out of the trials themselves. So at UVRI IAVI, we've been privileged to be engaged in HIV trials right from phase 1. And currently we are involved in a prevention drug trial, a PrEP trial, that's an injectable cabotegravir, that is actually a phase 3. So we've been able to participate full circle. However, in this presentation, I really want to emphasize the fact that even as far as R&D is concerned, there is still a lot to be done, much as in that area, maybe the gap is not as big as it is for the manufacturer. So here, I'm coming back to my actual topic, which is to look at what end-to-end product development is. And here we are looking at from the preclinical, from the idea, when a new disease comes up. So for COVID, the structure was shared and scientists got to work. So right from the very beginning to the point where we have at the end, this child that is actually having a shot in their arm of a product that has been developed. So that's our dream really for HIV, that one of these days we will have an HIV vaccine. So previous speakers have already highlighted how well South Africa is doing, and there are a few other countries. Egypt was mentioned, Morocco. They are already involved in manufacturing. However, most of this is really around packaging, labeling, the fill and finish. And I like the fact that Patrick mentioned diversification. We will not all be doing the very same part. So some of us can actually be involved in the R&D, while others contribute to the manufacturing. And here I want to also highlight the fact that within the continent, there are over 80 facilities that can manufacture sterile injectables. And this is part of that chain that we are talking about when it comes to that end product, that vaccine getting into somebody's body. And to get to the full level of what we need, money was mentioned. So we are talking about upwards of $200 million in order to just have the facility, have it accredited, and also ensure that our regulatory authorities are up to speed as far as being able to approve this product and access it, so that what is getting in the arm of that child or that adult who needs the vaccine is actually something that is safe. And I wanted to highlight some reviews that have been done on this topic, and they've really said what we need. So we need, of course, the money. We need to invest in our regulatory authorities. We need manufacturers, but we also need new technologies. So specifically, why HIV? Why do we need an HIV vaccine? Why should Africa in particular prioritize this? So globally, the target was that by 2020, there would be 500,000 new infections. So the yellow dot there reflects what the dream was. Someone mentioned the 95, 95, 95. It was a high dream. So we are not there. We are quite far from bringing down those new infections. And unfortunately, Africa is disproportionately affected. So of those 4,000 new infections every day, 60%, that is about 2,400 of those cases of HIV, the new cases, are within Africa. So it's really important for Africa to prioritize an HIV vaccine. Yes, you can see from this curve here, in the 1990s, it was at a peak, and then many interventions came into being. So ARVs came up, condoms, the behavior change, and all those tools that we are all very proud of. Unfortunately, these tools on their own are not able to take us to that dream that we have of bringing those new infections down to zero, if possible. So at the moment, it looks like a vaccine would be that magic bullet, which if was added to the tools for HIV, would help us to achieve these goals. So I just bring this slide to highlight what vaccines have done in other disease areas. So for measles, for pertussis, for smallpox, and here I have a little story specifically about measles, because people are worried about how maybe the COVID vaccine is not 100% effective. We have live stories of children vaccinated against measles. They could get measles, but then it's not severe. So that is really another case to say that vaccines are the way to go. Apart from that, if you look at the statistics for the regional AIDS, you will see that most of the people living with HIV, so take into consideration the costs of treating HIV, most of this burden, of course, the deaths as well, are within Africa. So an HIV vaccine has been proven to be a public health tool that really can bring diseases down. So I hope I've convinced you that this is where Africa needs to put a lot of its efforts. And then a little bit about the forerunners. So we have broadly neutralizing antibodies, first discovered naturally in people with HIV. Unfortunately, it is usually not able to help the person who it has been discovered in. Why? Because HIV changes a lot, it mutates, and also by the time the person has developed these antibodies naturally, usually their systems have had quite a beating from the HIV itself. So what has been happening now is scientists have developed these broadly neutralizing antibodies in the lab. And at IAVI, we are very excited to be one of the IAVI centers that is going to carry out these studies. It has already started in America, it started in South Africa, and we are hoping to join very soon to evaluate these passive antibodies. Of course, they would only protect for as long as the antibody is within a person. And also IAVI with partners is looking at other technologies, other front runners, other avenues. So the Germline Technology is actually a way of having the body itself develop its own broadly neutralizing antibodies. So unlike the first one where you would only be protected as long as the antibodies are within you. For the germline, you would be making your own broadly neutralizing antibodies, your own protection. So that's an exciting tool that is likely to change the future of HIV development. Also, of course, the messenger RNAs that have been talked about very much. And we all know COVID was the first example. And now these technologies are also being brought. So here at MRC, within the Institute, there is somebody who is using this technology, but to develop a Rift Valley vaccine. So once the technology is here, this is what I was talking about, developing R&D capabilities so that together we can really increase the pipeline of products that speak to the challenges that we have within Africa. This I'll not go very much into, but just to say that a lot has already been done to transfer technology, and we have to keep working at this, of course, because the gap is a big one. Then my final question was really, how do we bridge the gap? Of course, partnerships are really key. There was a picture earlier about our Ministry of Science and Technology that has taken an interest after seeing the challenges that COVID brought in putting investment into this area. And so we believe that the time is actually ripe for Africa to begin to support manufacturing, yes, R&D as well, and also to partner with the private sector. So in this picture, the Uganda Investment Authority is partnering with a local scientist who developed a product for COVID. Of course, it is still under trials. So really just to emphasize, we need those partnerships. And I'm just re-echoing what the others have said. And this is my last slide. I want to thank those who have contributed, but this picture speaks to the vision that we have. If you will see the beginning there, discussions, but finally to a healthy people, a world that is free of HIV. Thank you so much. Back to you, Rachel.
Thank you so much, Dr. Okech, and thank you so much for showing us just how close we are to the finishing line when it comes to HIV, and for being part and parcel of this forum this afternoon. So as I had promised at the beginning of this meeting, we intend to only take 2 hours of your time. I am now down to the last 28 minutes. And so I'm going to try and be as efficient as possible with the Q&A session. What I'd like to do is to use the lineup just as we've had in terms of how the speakers followed each other. And I'll be putting to each speaker a specific question that is either in the chat or in the group. And then I'll have you address that, but also give us one rallying call, because this will be your final opportunity to address us. One rallying call with regards to what do you think we need to do potentially in the next 6 months or so in order to be able to have an impact on what we are discussing today, which is what is the way forward and what are the key next steps. So allow me to start with Dr. Ndembi. Dr. Ndembi, if you could kindly put on your video. I just want to make sure that the person to whom I'm about to put a question is actually with us.
Hello, sorry. I can't hear you. I'm trying to multitask.
Perfect. Doctor, so my question to you, and this came up because you have been addressing partnerships, isn't it? And as you talked about the partnerships between CDC and CEPI, the question that's coming is, do you see a role for the private sector in the partnerships as they're currently designed, or what role do you think private sector, and here we could be talking about big pharma, but we could also be talking about African companies, what role do you see them playing, and also what would be your rallying call to us as you close?
I think we have to be very careful. It depends on what we're looking at. As we speak, I think...
Sorry, Dr. Ndembi, if I could kindly ask Dr. Okech to please to stop sharing her screen so that we can go back to the neutral screen. Dr. Okech?
What I'm saying is that we need to be very careful the way we frame that question in terms of engagement of the private sector. I think we looked at, if you look at the COVID-19 response on the continent, they have contributed significantly. Okay, so we need to be sure that we get them on board, philanthropists as well, to be sure we drive this initiative. I've said it at the beginning of my presentation that there's now a huge momentum, political commitment. I think also probably we're shaking the trees here, and probably those in the private sector can see value to invest into the vaccine manufacturing business. Let's put it that way. So we need to make it attractive, and it boils down on what Patrick and also Martin mentioned, that we start looking at really making a case for it. So if you make a case for it, I'm sure we have business, the financier, the big financier on the continent that will invest into. So my take is that, yes, I think they have a key role to play here. Yes, if you look at the response in terms of funding, I don't think we've done a kind of analysis on that. We can start doing that to see what has been their contribution in terms of really a part of contributing to COVID-19 response, even beyond infectious disease. They are doing a good job. So I think we need to really start driving that component. And that's why the public-private partnership comes into play. So all hands on deck to be sure that we meet the continental aspiration. I think that's what I can answer for now. Back to you, Madam Chair.
Okay, thank you so much. And so at this point, I would like to ask Martin. Martin, if you could kindly put on your video. And in the presentation, as you spoke to us about the South African hub, and I think we're all sufficiently excited about it, is also a comment that was made about the importance of developing the workforce, and the workforce that would then help us as Africa to also be able to take on the responsibility and the role that comes with being able to take on this hub and also the other hubs that are proposed to be developed. So maybe just to hear your comment about the role of education, universities and others, even as you give us your rallying call.
Okay, so universities, South Africa has, well, Africa has some good universities. Unfortunately, most of them are in South Africa. So it is important that we increase the training on biochemistry, pharmacy in the rest of Africa. But what we have seen, and I was trained in South Africa, I saw a comment that that people, once they train, they then leave Africa, they go to Europe. Well, yeah, that's me. I left Africa. Why? Because there was no job. So this is a vicious cycle. We need to create the jobs to be able to keep in Africa the people that are trained there, but we can't have the jobs unless people are trained. So I guess my rallying cry here is going to be build education, build in the long term. So build with a 20-year vision. I'm afraid much of my life in Africa, I was seeing politicians think with a 4-year vision or a 5-year vision. But in order for Africa to be able to get out of its dependency on the rest of the world for its vaccines and its drugs, it requires the politicians to think with a 20-year vision. We need to be building the training centers. We need to be then providing work so that people, once trained, they don't say, well, there's no job for me here, I'm going to go to Europe. And I'm also going to just add one more thing. We need to have confidence in the African manufacturers. So when I was in South Africa, we had a joke. I apologize for this joke. It's of the doctor saying to the patient, I'm going to give you a local anesthetic. And the patient says, but doctor, I don't want a local anesthetic. I want one from Europe. We need to have confidence in the products that are produced in Africa. And this means that the African regulatory agencies need to be strengthened. This is a key priority. So my rallying call, I'm going to copy somebody else. Yes, we can.
Thank you so much. And the somebody else will remain unnamed for this time, isn't it?
Of course.
Thank you so much. And thank you for, because this ties into what I'm about to ask Patrick. Patrick, if you can kindly put on your video. As you were speaking, and I think you were at the point of speaking about market shaping and market forming, but one of the comments that was made in the comment section is about vaccine hesitancy. So do we actually, as part of, as Africans, do we accept, are we taking up this, these vaccines because there's fear, there's suspicion? We've now got a new word, anti-vaxxer movements, that are barriers that to the uptake of vaccines. And what would you comment about that? And also the work that needs to be done in order to deal with that as a barrier, even as you give us your rallying call.
Yeah, so I think one way of looking at this whole hesitancy with respect to vaccines, and it's come to a focal point as people have to really think through all of the voices out there, both the for and against, and the serious and the nonsense. Amidst all of this is this unsurety about what are they on the outside trying to do to us in Africa. And I think that certainly making vaccines on the continent, developing vaccines on the continent, and testing vaccines on the continent will possibly shift the needle for those people who are hesitant because it's coming from the outside and targeted at Africa for whatever reason. And so that is one motivating factor that I can immediately think of in terms of dealing with this whole issue of vaccine hesitancy as it connects with this conversation of building vaccine manufacture and vaccine development capacity on the continent. Obviously, this is a far bigger issue, and it really, at the heart of it, in my opinion, ends up, or it's fueled by the lack of confidence, to put it euphemistically, or the plain distrust of governments and authorities and institutions eroded over time. So there needs to be some building of that trust factor into the future as well to deal with that. In terms of a rallying call, I think that I just want to respond to Pete Gardner's comment about conjugate vaccines and expanding into other technologies as well, more complex technologies. This is in progress, Pete, on the continent. There are groups at, I work for BioVac, and we as a group are developing conjugate vaccines. We have actually developed the Haemophilus influenza B conjugate vaccine technology, which we have out-licensed. So we have outward technology transferred that technology to a company in Indonesia and one in Japan and one in the US at the preclinical stage of development. So this work is underway. The capability is embedded in the continent. We need to expand it and build it out and drive it towards commercialization. And that's where we're at with respect to the development of a Group B streptococcus vaccine now. We have demonstrated the efficacy in animal trials, and we're looking for funding now to drive it through to the first in human trials. So the rallying call, I think, is the first point, and I think the most important point connects with sustainability, and that we have to do something about demand certainty if all this excitement, energy, and even money that we can secure now to build capacity will be spent wisely and will be around in 10 or 20 years' time. The market issue needs to be solved. And then I think a more complex issue, or equally complex issue, is the one of building capacity, but you don't know where to start first. We're looking for a project, the project's looking for a facility, the facility and the project's looking for money, the funders are looking for a project, and no one wants to get this ball rolling first. And in the mix of all of this is the point that I made earlier with respect to workforce development, that we wait for all of these other things to be in place because we don't have a spare dollar to spend or waste. And then only later in the day do we then bring people on board, recruit them, and we have to develop them because these skills on the African continent are not available readily. So the challenge is, how can we develop the workforce at risk and be ready for these opportunities over the next while? And I think this is a point that that Martin also made very, very well. Thank you.
Thank you so much, Patrick. And I'm really happy to see how there's some interweaving between all the different presentations that we've been receiving. And so, And so there's a conversation going on about in the chat section, and I'm hoping that we can be able to look at it, about the African Medicines Regulatory Harmonizing Project. And I think we received a response to look at AVRF, Africa Vaccine Regulatory Forum. So I think Jane, if you could, who has put in that comment, if you could kindly give us a link, we'll be able to look at that. I think as I go on, I see a feedback from Noni about non-R&D groups such as civil society, lay groups should be brought into the discussion table, just responding to the issue about vaccine hesitancy, and so that we can be able to have goodwill in the population, just as Patrick is talking about it. And I'm really happy that today we have a multi-sectoral group who are in this audience, so that we can ensure that even for those of us who are not in labs making these developments, we do have a role and we're able to play this role. So Dr. Okech, over to you. If you could kindly put on your video. And the question that I'd like to put to you is from Carol, and what she's asking is there any value to try and leverage the vaccine momentum to the pharmaceutical capacity? So just yet again, being able to take advantage, or do you feel that it's just too different? And so even if you could kindly speak to that.
Thank you so much, and thank you for the question. I think it's Patrick who mentioned that even the capability for one particular vaccine needs to be changed if it's another, but I still believe it's very important to take advantage of the momentum, especially the interest from governments. I believe it's a way to build capacity for all these different stakeholders. And I also feel that it's a good time for partnership, not just partnership between manufacturers, but even partnership between researchers. And coming to that last point where someone was talking about community engagement, I think the South African group did very well. They, from the start of their government vaccine initiative, they already involved community groups. So I think we can learn from that. And as far as R&D, we now always also emphasize the importance of community engagement, and just even from the very first slide where I mentioned the target profile, the target product profile, it's very important to already start engaging the population to be sure that even the product you're working on will be accepted, will be usable. So it's a multi-pronged approach that needs all of us together. So my rallying call is just going to be the word partnership. We need each other, we need to work together so that together we can fill these many gaps. Thank you.
Thank you so much, Dr. Okech. And I think really you've brought us around to the same place where we started, which is to say that we are going to need partnerships in order for us to be able to succeed in this. As we said, Africa has to a large extent lagged behind on its capacity, not only to fulfill its own needs for vaccines, but also to be able to participate in the international vaccine market. And we've gotten so much from our different presenters. And it's really exciting to be able to hear some of the work that's already ongoing, some of the key successes that we made, some of the bold visions that we have set for ourselves. We started off with being advised that the objective is to have 60% local manufacturing and only 40% coming from other places, from importation, and also how we have been able to make quite a number of leads with both the hub that has been set up in South Africa, and also the work that Patrick has described for us. And as we go on, we've seen that some of the rallying calls that we've received is first, we need to have confidence in African products. We are sitting here largely as Africans, talking about Africa, talking about fulfilling the needs that our own populations have. And so being able to have confidence in African products, understanding what it's going to take to make the African, who is our consumer, actually have that confidence. We've talked about demand certainty. What is it going to take in order for us to be taken seriously as a market? What are we going to need to do in order to be able to have demand certainty that would then spur on the need for us to be fed as a market, and that our private sector, our development, our developing agencies that are doing the R&D would be in a position to be able to take advantage. So then we've got the issue of partnerships with non-R&D groups, and I think this cannot be overemphasized, talking about the role that they play in getting the rest of the population to understand and to be able to take up the vaccines with confidence, so that even as we work on this, we'd be able to take along the whole population with us and not have many left behind. And also the large question of financing. And I think the conversation continues in the chat section where we were saying that bankable business planning is what will be able to get us the financing that's needed. There's financing in the private sector, there's financing in the public sector, but it's about being able to access that and being able to utilize that very effectively, so that we are not getting into the challenges that Martin described for us, where you are able to invest in local manufacturing, but then it actually results in greater costs at the purchase, at the shelf price, than it would have costed if you had actually imported. So those are really important learnings that we have gotten. And at this point, I see we are 10 minutes to the end. I'd like to invite Charles Kamau, who is on the AVI committee too. Charles, if you could kindly give us the closing remarks. Thank you.
Thank you very much, Rachel, and to everyone for such an enlightening conversation. I hope everyone has taken as many notes as I have, because it was also a learning session for all of us as well, even as we're thinking about, and you'll realize that the title of this particular webinar is a question, because we really didn't have all the answers, and that's why I'm appreciating all the discussions that are coming up from quite across the sector. Having people who have spend their time at the lab, having people who are, bringing in conversations from the field, and people who are bringing conversations from the boardrooms, people who are bringing conversations from the laboratory point of view, and it is really, such a mix. And just to say that this is not the beginning of this entire discussion. And I would like to say that, we've listened to some of the startling statistics, thinking about only 1% of African vaccines coming from Africa, being 99% dependent outside of our borders is startling, and also I think even there's no better time to use this example than COVID already exposing our vulnerabilities when it comes to accessing some of these vaccines. So this is definitely a conversation that, has only started. And, just to thank from the foremost, Dr. Lindiwe Makabulo, who through her office and that of the WHO, World Health Organization, opening up an arm of partnership to work on different fronts. And some of the things that Rachel has rightly summarized, from private sector engagement, political goodwill, which was touched on by the African CDC's Dr. Dembi, and also also looking at it from a regional point of view. Is it better for more strengths to come together to achieve a better goal? And even what Patrick also mentioned about standing with the end in mind, coming down to Martin, who discussed in great length the importance of us looking at things from a multilateral tech transfer point of view. And really, Brenda, and I really liked it, because when she was talking through what they've been able to do just across, in Uganda on HIV, the HIV vaccine, now it just shows that the time is now, like we are ready. So all we need to do is just bring ourselves together and harness all those powers. And I like a statement that is constantly said by Patrick, which he always says shifting the needle, sort of shifting the powerhouse to where the biggest problem is. And I think even as we think about it as vaccine security, we've seen how, just that shock to the African health systems has been a bit of a challenge to most of us, jobs lost, livelihoods lost, across all sectors. It has been a security issue. So, and I think if we start to shift our mindset, thinking about it as something that we need to think about now, something that we need to sort of, rightly put that if for you to enjoy a shade, the time to plant that tree was 10 years ago. And I think we've really now started a very, very important conversation that we hope that you're going to be part of us, when through the African Vaccine Manufacturing Initiative. We would like you to be more and more involved in it. Check out the website, get in touch. We will definitely be sharing a package, more of a package together with everything that AVMI does, and we will be sending this to emails that used to register. And allow me at this particular juncture to just thank a few people who have made this possible. First and foremost is the African Vaccine Manufacturing Initiative, from the board led by Professor William Mpopo, and the secretariat led by the very able Patrick and Commissioner Melissa, who have been helping us to put everything together. The communications working group, which I'm privileged to co-chair with Tolu Dis, who is based in Nigeria. IAVI, and more specifically within the body of IAVI USAID, which has made it possible for us to have this translation in French as well. So thank you very much, Yolanda, Ethel, and team. Ethel also happens to be sitting in the technical working group of the African Vaccine Manufacturing Initiative. So thank you very much for that. Africa CDC, those open arms of, sort of looking at it from a point where we can all work together to achieve the same goal. The African Union, of course, the political goodwill, and that I think that has been repeated very, quite often through the last 2 hours. The fact that it's going to be very impossible for us to do anything without the right political machinery and the right political fire beneath us. Rachel, you've done a fantastic work. Thank you very much for steering these discussions. And also, I liked it that you actually put each of the speakers on the spotlight to give us what is that rallying call that we will all, we can all follow. And I could see quite a number of quotable things that we can, we can move forward with. To all the participants, the hundreds of you that have joined from tens and tens of countries, thank you very much. And we also do hope that this has been, a session where, becomes a session where collaboration is also going to happen moving forward, both inter-country, inter-continent, and within the countries that you are in. Thank you very, very much. And rightly say the slides and the remarks from Dr. Makubalo will be shared in due time. Thank you very much. If there is nothing else from the rest of the team, I would like to officially bring this webinar to a close and hope that we meet again with better results of what we've been discussing today. Thank you very much.
Thank you very much.
Thank you, Charles. Thank you very much, everyone. And yeah, it has been a pleasure, and we hope that it's a continuation of the partnerships. So thank you.
Thank you. Bye-bye.